for fear of the fact that that chronic illness can lead to other problems down the road. Hi, welcome to Getting Understanding with Dr. Daryl Ellis. We're here to reconvene. We want to talk about some new topics, specifically one that has been talked about quite a bit on social media, and that's anxiety. I want to outline for you the major risk factors for anxiety. Risk factor number one, trauma. Children who have endured abuse, children who necessarily have witnessed traumatic events in their upbringing often are at significantly increased risk for anxiety-related disorders as they mature. We even see them while they're adolescents. If you've experienced some adolescent trauma, whether you're knowledgeable of it or not, and you're starting to have anxiety-related symptoms, and we'll discuss those in just a minute, then you need to go ahead and see your healthcare provider for appropriate diagnosis and referral to a counselor so that you can work through some of those early childhood traumatic events and not allow it to manifest as a physical manifestation of anxiety. The next risk factor that I'd like to discuss is stress related to an illness, particularly a chronic illness. A lot of people who deal with chronic illnesses, depression, whether it be diabetes, whether it be hypertension, cardiovascular disease, chronic lung disease, they can develop anxiety related to that chronic illness itself for fear of an exacerbation, for fear of the worsening of their chronic illness, for fear of the fact that that chronic illness can lead to other problems down the road, particularly if it's a chronic illness like a malignancy, a cancer. You're always concerned about whether or not it's going to recur, whether or not it's going to show back up at a later time or at a later visit by a later laboratory study or later radiographic study. Chronic disease is certainly a source of anxiety and stress. And if you are suffering from chronic disease, be sure to talk to your healthcare provider about doing the proper screening for anxiety and get you on the proper treatment to minimize the symptoms of that anxiety. The next and probably the most common of these is going to be a buildup of chronic stress-related environmental stimuli. Wow, that's a lot of words. What I mean by that is if you have chronic work-related stress, if you've got family issues that have produced stress in your life, marital issues, issues with your children and things that are concerning them, over time, these daily stressors can build up and manifest as an anxiety disorder. You can start to have panic attacks because, again, like what we talked about with chronic illness, you don't know when these things are going to pop up as a new problem on top of the chronic and old problems that have been going on and plaguing you for years and years and years. So work-related stress, family issues, chronic small stressors that accumulate over time can trigger into a major anxiety issue. If these are problems that you're having, again, counseling is the first therapy. After that, if you can't change the environment that you're in, if you can't find a different work environment, if you can't work through some of the family issues, whether they be marital or with respect to your children through counseling, then you may need medical therapy. One of the other stressors one of the other risk factors for anxiety are personality types. The specific one that I'm thinking of is type A personality disorder. I don't know if you guys have heard of ever type A personality disorder, but those are the people who tend to be perfectionists. They want everything to be exactly right. And they put a lot of pressure on themselves to make sure that at least as far as they're involved, they do everything perfectly. None of us is perfect. And the anxiety related to trying to make sure that everything is perfect can produce significant problems with anxiety that can lead to sleep disorders, difficulty going to sleep, difficulty staying asleep. A lot of people with type A personality disorders complain of when they lay down, their mind just never shuts off. Their thoughts continue to race because they're already thinking about the things that they need to try to do perfectly the next day before the next day has even arrived. Living in the future often produces anxiety. Another common source of anxiety and a risk factor is drug and alcohol abuse. Drug and alcohol abuse often precipitates anxiety. In many cases, it's linked with the withdrawal associated with the chronic use of drugs and alcohol. While the person is participating in the drugs and alcohol, unless they're stimulant drugs, when you start going through that early withdrawal, you develop intense anxiety because you know you want to and need to get some more of whatever that substance is. The anxiety related to that withdrawal is what we call the cravings. cravings and obsessive thought processes about using and obtaining drugs and alcohol can definitely be misdiagnosed as anxiety, which is why most psychiatrists, most good psychiatrists, want to make sure that there's no comorbid alcohol or drug use before they actually make a formal psychiatric diagnosis. If you're struggling with addiction, whether it be to drugs or alcohol or a combination of both, talk to somebody who can help you get through that addiction process before you go to someone and get labeled with a psychiatric disorder that may not even be there. Thanks for watching. I hope that you got something out of the content on today's YouTube channel. Be sure to hit the like, hit the subscribe, and that bell notification so that as we roll out new content, you'll be the first to be notified of it. God bless you.